So, you're sitting in the doctor's office and you've just been told you need cataract surgery. But then comes a question you probably didn't expect. It feels a bit like a cosmic coin toss. Do you get both eyes done on the very same day, or do you space them out? Believe it or not, this one choice has some pretty big consequences for your vision, your wallet, and yeah, your day-to-day life.
So, what is the right call here? Do you go for the one-and-done approach, or do you treat it like a two-part series? This is the big question we're going to break down. Let's really dig into what each of these options actually means for you.
Okay, let's dive in. On one side of the coin, you've got what's called immediate sequential bilateral cataract surgery, or ISBCS for short. Just think of this as the let's get it all over with in one go option. On the other side, you have delayed sequential, or DSBCS, where you do one eye, wait a bit, then do the other. And as we're about to see, these two paths can lead to a very different experience right after the operation.
First up, let's talk about the thing you're probably most curious about. What is the world going to look and feel like? And this is more than just a little blurriness. We're talking about how your brain handles what is essentially a major software update for your eyes.
Okay, so check out this word, anisometropia. It sounds complicated, but it's really just a fancy way of describing what happens when you have one brand new high-definition eye and one old, foggy, standard def eye. Your brain gets these two totally different pictures and tries to mash them together. The result? It can feel like you're trying to walk a straight line with one high heel and one flip-flop. They call it the drunken sailor effect, and for very good reason.
And this quote from a patient named Robert just brings it all home. It perfectly captures how frustrating that visual imbalance can be in the real world. I mean, simple, everyday things suddenly become a huge challenge because your depth perception is just gone. This is what life can be like for weeks if you go with the staggered surgery.
Now, let's look at the actual recovery timeline. With same-day surgery, you've got one period where you have to take it easy. No heavy lifting, no swimming, for about 2 to 4 weeks. Then, you're done, finished. But with staggered surgery, you have to go through that whole recovery process twice. You heal the first eye, and just when you're getting back to normal, you go back and start all over again with the second eye. That can stretch your total downtime to a month, maybe even longer.
But, and this is a big but, there's a really important trade-off. Same-day surgery is super efficient, sure, but it also means both of your eyes are healing at the exact same time. So for that first day or two, you are going to be completely dependent on someone else for pretty much everything. If you live alone, this is a huge factor you've got to think about.
All right, so we've covered how it feels physically. Let's switch gears and get into the practical side of things. We're talking money and just the general hassle factor.
This right here is so important. You have to be your own advocate. Seriously, do not make any assumptions about what things will cost. These are the exact questions you need to ask your insurance company. Getting the answers to just these 3 things could literally save you thousands of dollars.
And remember, the cost isn't just about the medical bills. Think about it. 2 different surgery dates, that's double the time you have to take off work. It might be double the time a family member has to take off to drive you. It's double the gas, double the parking, it's double the logistical nightmare. All these little hidden costs can add up fast.
And here's a little detail that turns out to be a surprisingly big deal: the eye drops. With same-day surgery, your schedule's easy. It's the same drops for both eyes at the same time. Simple. But with staggered surgery, you're suddenly juggling 2 different overlapping schedules. You're trying to remember, wait, was it 1 drop for the right eye and 4 for the left, or the other way around? This confusion can lead to something called drop fatigue, and it makes it way easier to make a mistake.
Okay, let's get into the heart of the medical debate now. This part is all about the clinical strategy and why your surgeon might have a very strong opinion one way or the other.
Now, if there is one huge flashing sign pointing toward waiting and staggering the surgeries, this is it. It all comes down to the surgeon's ability to learn from the first eye to absolutely perfect the second one.
So this idea of a refractive surprise is really key. See, even with the most precise measurements beforehand, sometimes the first eye just doesn't heal exactly the way the models predicted. By waiting, the surgeon gets to see that real-world result, and they can tweak the lens calculation for your second eye to nail the final outcome. For anyone who's had LASIK before, or if you're really hoping to be glasses-free, this is a massive advantage.
All right, we have to talk about the elephant in the room, infection. Endophthalmitis is, without a doubt, the nightmare scenario for any eye surgeon. It's a very serious infection inside the eye that, in the worst cases, can cause blindness.
But
And this is a really important but. Let's put that fear into perspective. The risk is incredibly small. We're talking about 1 in 3,000 cases for each eye. The old school thinking, the historical concern, has always been, well, what if that 1 in a million lightning strike happens to both eyes on the same day?
And this is how modern medicine has totally changed the game. When you get same-day surgery now, the operating room basically does a full reset between your first and second eye. Everything is treated like a totally separate surgery. They use separate tools, separate fluids, separate medications, everything. These super strict rules make a simultaneous infection almost statistically impossible, but of course for some people, almost isn't zero.
So, we've covered a lot of ground here. How you'll see, how much it'll cost, and the risks involved. Now let's pull all of this together to help you figure out how to make that final call.
This little table really lays it all out, side by side. You can see it clear as day. Same-day surgery gives you a faster total recovery. You avoid that weird vision imbalance, and it's way more convenient. On the other hand, staggered surgery gives your doctor that second chance for maximum precision, and it keeps that already tiny risk of infection completely separate for each eye. It's all about the trade-offs.
And you know, that's really what this all boils down to. It's a straight-up choice between maximum convenience and maximum precision. Are you trying to optimize for getting back to your normal life as fast as possible? Or are you trying to optimize for the absolute best chance at perfectly fine-tuned vision? That's the question at the heart of it.
So, I'll just leave you with this final question to think about. What's your #1 priority? A quick and easy return to your life, or taking a little more time to chase that second chance at perfect vision? If you can answer that honestly for yourself, you'll have all the clarity you need to have a really confident conversation with your doctor and make the choice that is absolutely right for you.